Here we are in part 8 of Blood on page 652. So we just noted that we have both the phenotypical situation, which is described in the far left, and the type of proteins involved are described next. And then here's the genotypes that are required. Okay, so those are the possibilities. It's important to remember that because it's possible that somebody contributed, for instance, sperm to a pregnancy, and mom would like to know if she's a type B with a type B baby, who contributed, and is it possible for there to be a contribution from somebody with a phenotype of AB? And the answer is most definitely. A B can be contributed. If the dad is an AB, he can contribute a B rather than an A. If the dad is a B, of course, then he could contribute a B. If dad is an A and he's heterozygous, he can at least contribute an O for a heterozygous type B. If dad is an O, he can also, again, contribute an O. So as it turns out that you're not able to tell just from the phenotype whether somebody is a parent. You have to go a little bit deeper into the genetic situation. And so just blood typing alone will not do it. But when you need to do a surgery and you need to have some units of blood available for transfusion or addition to your surgical situation, then actually knowing the blood type matters a lot, quite a lot. And so the patient will die if they don't get the right blood type. And what is that blood type? So here in the AB situation, since we have both A and B proteins, we don't actually have antibodies, no immunoglobulins for A or B. If we have an individual with type B proteins, they will actually have an antibody to A. Okay, so we can't give them type A blood, nor can we actually give them type AB blood because they will coagulate the blood that's given to them because they have the immunoglobulin which will bind to an A on the surface. So here we have A on the surface, here we have A on the surface. We don't want to give them these blood types, but they can definitely receive blood from B and O. Okay, this is the universal recipient because no antibodies. They can get blood from anyone, presumably. Okay, then we have type A. Type A has anti-B immunoglobulin, and so anything with a B on it, we can't give them AB blood or B blood, so they will have to settle for type A or type O blood. In the type O situation, we have none of those AB proteins, and so we have anti-A, anti-B. This is the largest group, as it turns out. It's hopefully also the largest type of donor, type O, because this particular type of blood type is going to be a good donor, but not a good recipient, right? So we can only get, if you're a type O, you can only get type O blood. You can't get blood from anyone else. And if you look at the percentages here in the population, depending on the ethnicities that are listed, white, black, Asian, Native American are listed here. Asians usually have the most type B. Western Europeans have the most type A. And overall, type O is the most prevalent. Type AB is the least prevalent. Okay, so you can sort of get an idea of what's going on. In the United States, probably A and O are the most common. And then if you were to get over to possibly Asia, then type B starts to become an important player, and then type A and type O. And in the American Native people community, type O is very predominant. Okay, So we come over here in terms of blood typing. You can type your own blood. You can mail away maybe $10 or so to Amazon and get yourself a kit. And it will come to you, and you can open it up, and there'll be a slide with a couple depressions. And you pour in your anti-A serum into one side that says anti-A, and you pour in your anti-B serum into the other side. And then you take a lancet and you put a drop of blood in the A, and you take another lancet and you drop another blood drop into type B. If they both happen to coagulate, then for sure you're an AB blood type. If in fact only the A coagulates and the B remains nice and fluid and with no coagulation, then you would be having type A. Okay, over here we have a type B coagulating, and the A remains fluid, so that means this person is type B. And here we have no coagulation on either side, so this is a type O person. There's a slight better chance of being a type O than any of these others. And then beyond that, a better chance of being a type A more than the remaining two. Okay, so then we talk about how do we deal with blood volume. We have plasma extenders, so we don't have to use formed elements, which could be dangerous. We're always expanding our blood when we drink water. Right, so that's always an important detail in terms of retaining blood volume and blood pressure, is have a drink of water, and you get more venous return as a result. Okay, and that concludes this chapter. Thank you very much.